Hello, I'm Dr. Robert Lelouch, a board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to answer the question, is it all right to paint during pregnancy? So basically, there is no direct evidence of any direct harm from exposure to paint, but we definitely recommend that you use common sense and take a cautious approach. I certainly wouldn't make a career out of painting where you're regularly and constantly exposed to paint. You want to have a well-ventilated area. You want to limit your exposure. Some would say use water-based paints, not oil-based paints or latex, but don't have a prolonged exposure. But more importantly, and this is what I frequently tell my patients, I'm more concerned about injury or fall. So I don't want you to get on a ladder. So if you want to paint the bedroom, you stay on the lower point, but if you get up high and you don't have good ventilation and you're up on a ladder and you fall, you can really hurt yourself. You can't take non-steroidals. You could injure seriously yourself or the baby. And so getting on ladders is something that I discourage. Do that with your partner. Have them get up and do the high parts. You do the lower parts. Take some breaks. When you're pregnant, you're going to get more backaches. More discomfort, so do it slow, but with a well ventilation. Certainly you don't want to be inhaling yourself, pregnant or not, constant paints and chemicals with a substantial exposure that can be harmful to you. It can give you asthma, irritation, lung problems, and so you don't want to get anywhere near that level of exposure when you're pregnant, but even without pregnant, you don't want that exposure as well. But if you are feeling well, not having problems with the pregnancy, you're staying off a ladder, you have well ventilation, you're doing a small amount of painting, you got some support, that should be fine, and the risks should be well within the acceptable range. I hope you found this useful. Please leave your comments. Thank you.